Picture this. It's 3048, and the Black Death has just arrived in your city. Bodies are piling up in the streets, entire families are dying within days, and the smell of death permeates every corner of the community. In this nightmare scenario, one figure walks calmly through the chaos, his grotesque bird-like mask and black leather robes making him look more like a messenger of death than a healer. This is the Plague Doctor, and his daily routine involves walking directly into the epicenter of humanity's greatest killer, treating patients who have almost no chance of survival, and somehow maintaining his sanity while surrounded by mass death on an industrial scale. What was it really like to live this existence? How did these men structure their days when every moment could bring infection and death? The reality of Plague Doctor life was far more complex and harrowing than the dramatic image suggests. These weren't just eccentric medical practitioners wearing strange costumes. They were desperate men operating at the intersection of primitive medicine and apocalyptic disease, trying to maintain some semblance of medical practice when normal healthcare systems had completely collapsed. They developed elaborate daily routines not just for medical efficiency, but for psychological survival in a profession that combined the highest possible risk with the lowest possible success rates. A Plague Doctor's day began hours before sunrise, with an elaborate preparation ritual that was equal parts medical protocol and superstitious protection ceremony. The famous beak mask wasn't just theatrical costume, but a complex piece of protective equipment stuffed with herbs, spices, and auric substances believed to filter poisonous air that caused plague transmission. The preparation of this mask alone took considerable time, as doctors carefully arranged specific combinations of rosemary, thyme, lavender, and other materials based on their personal theories about disease prevention. The iconic black leather robes served multiple practical functions beyond their intimidating appearance. The leather was treated with oils and waxes that supposedly repelled disease-carrying vapors. The full-body coverage minimized skin exposure to contaminated air and materials. The dark color concealed the inevitable bloodstains, bodily fluids, and decay that accumulated during patient visits. Some doctors wore multiple layers of treated clothing that they could remove and burn after particularly dangerous exposures. But here's where Plague Doctor routines become truly fascinating. These men developed personal protection protocols that were surprisingly sophisticated, given their limited understanding of disease transmission. They understood empirically that close contact affects plague victims increased infection risk, leading them to create elaborate procedures for minimizing exposure while still providing medical care. They maintained specific distances from patients, used long wooden sticks to examine bodies and manipulate clothing, and developed hand-washing rituals using vinegar and other substances they believed possessed protective properties. The daily schedule of Plague Doctor visits followed careful geographic routes designed to maximize efficiency while minimizing exposure time in any single location. They planned their rounds to visit the sickest patients first, when their energy and attention were at peak levels, saving routine follow-up visits for later in the day, when fatigue might compromise their protective procedures. They avoided spending unnecessary time in heavily contaminated areas and developed rapid assessment techniques that allowed them to evaluate patient conditions quickly, without prolonged exposure. Each patient visit followed a standardized protocol that balanced medical evaluation with personal safety considerations. Plague doctors developed techniques for diagnosing plague symptoms from safe distances, using visual observation and patient reports rather than physical examination whenever possible. They carried specialized tools that allowed them to check pulse, examine wounds, and administer treatments without direct skin contact. Their medical bags contained not just medications but protective equipment and emergency supplies that could save their own lives if exposures occurred. The treatment arsenal available to plague doctors was limited, but represented the cutting edge of medieval emergency medicine. They administered herbal concoctions designed to strengthen the body's natural resistance to disease. They performed bloodletting procedures that they believed would remove contaminated blood and restore healthy circulation. They lanced buboes and applied poultices that were intended to draw poison from infected lymph nodes. Most importantly, they provided comfort care and spiritual support to patients facing almost certain death. The psychological challenges of plague doctor practice required extraordinary mental resilience and emotional coping strategies. These men witnessed death rates approaching 90% among their patients, meaning that almost everyone they treated would be dead within days of their visit. They watched entire families disappear, saw children die in front of their parents, and experienced the gradual collapse of normal social structures as communities were decimated by disease. Maintaining professional composure and personal sanity under these conditions required remarkable psychological strength. Many plague doctors developed rigid mental frameworks that helped them cope with constant exposure to mass death and human suffering. Some adopted fatalistic attitudes that accepted death as inevitable while focusing on providing comfort rather than cure. Others maintained optimistic beliefs that their treatments were making genuine differences despite overwhelming evidence to the contrary. Religious faith provided psychological anchor for many practitioners who viewed their work as divine service that would be rewarded in the afterlife, regardless of earthly success rates. The economic realities of plague doctor practice created unique financial arrangements that reflected the extreme risks and social value of their services. Most plague doctors worked under municipal contracts that provided substantial compensation in exchange for commitment to remain in plague-affected areas when other medical practitioners fled. These contracts often included provisions for their families in case of death, hazard pay that exceeded normal medical fees, and exclusive access to certain medical supplies and protective equipment. The business model of plague practice required careful resource management because normal supply chains often collapsed during epidemic periods. Plague doctors had to maintain stockpiles of medications, protective equipment, and emergency supplies that could sustain their practice when markets closed and trade stopped. They developed relationships with suppliers who could provide essential materials during crisis periods, often paying premium prices for items that became scarce during epidemics. Some plague doctors operated as independent contractors who negotiated individual agreements with wealthy families desperate for medical attention during epidemic periods. These private arrangements could be extremely lucrative, but also carried higher risks because private patients often delayed seeking treatment until their conditions were most advanced and contagious. Private practice also meant less institutional support during emergencies and greater personal responsibility for acquiring protective equipment and supplies. The social isolation that accompanied plague doctor practice extended far beyond their working hours and affected every aspect of their personal lives. Community members feared plague doctors as potential carriers of disease, leading to social ostracism that made normal relationships impossible. Many plague doctors lived in separate quarters away from their families to prevent disease transmission, creating lonely existences that compounded the psychological stresses of their profession. Family relationships suffered enormously when plague doctors continued working during epidemic periods. Wives and children often fled to safer locations, leaving practitioners isolated from emotional support systems when they most needed comfort and companionship. Some plague doctors made deliberate decisions to abandon family life entirely rather than risk transmitting disease to loved ones, choosing professional duty over personal relationships in ways that created lasting psychological trauma. The professional relationships between plague doctors and other medical practitioners were often strained by the extreme nature of epidemic medicine and the desperate measures required during crisis periods. University-trained physicians often criticized plague doctors for using experimental treatments and abandoning established medical protocols. Plague doctors resented criticism from colleagues who had fled rather than remaining to provide care during epidemic emergencies. However, plague epidemics also created unique opportunities for medical collaboration and innovation, as practitioners shared information about effective treatments and protective measures. Plague doctors developed informal networks where they exchanged observations about disease progression, treatment outcomes, and protective procedures. These professional relationships often transcended normal guild boundaries and social hierarchies, as survival became more important than professional status. The experimental nature of plague medicine forced doctors to abandon traditional treatment protocols and develop innovative approaches based on direct observation and desperate necessity. They tried combinations of medications that had never been tested, developed new surgical procedures for treating buboes and other plague symptoms, and created protective equipment using trial and error methods that sometimes worked and sometimes failed catastrophically. The most successful plague doctors developed signature treatment approaches that reflected their personal theories about disease causation and cure. Some focused on herbal medications that they believed could strengthen the body's natural resistance. Others emphasized bloodletting and purging techniques designed to remove contaminated substances from the body. A few pioneered primitive quarantine and isolation procedures that anticipated modern public health approaches to epidemic control. Record-keeping became an essential part of plague doctor practice, as practitioners attempted to document their observations and treatment outcomes for future reference. These medical records provide some of our most detailed information about medieval epidemic disease and treatment approaches. Plague doctors recorded patient symptoms, treatment protocols, outcomes, and their own theories about disease transmission and prevention in documents that became valuable medical historical sources. The geographic mobility required of plague doctor practice meant that many practitioners developed expertise in regional disease variations and treatment approaches used in different areas. They became traveling repositories of medical knowledge, who could share successful treatments between communities and adapt their approaches based on local conditions and available resources. This mobility also meant that plague doctors often died far from home, alone and without family support. Urban plague doctor practice involved different challenges and opportunities than rural practice, with city practitioners serving larger populations but also facing greater disease concentration and resource competition. Urban doctors often worked with municipal authorities to develop public health responses to epidemic outbreaks, including quarantine procedures, body disposal systems, and emergency medical facility organization. They became key figures in municipal crisis management during epidemic periods. Rural plague doctors served scattered populations across wide geographical areas, requiring extensive travel and self-sufficiency that urban practitioners didn't face. They often served as the only medical practitioners available in remote areas during epidemic periods, carrying enormous responsibility for entire communities' medical care. Rural practice also meant greater isolation from professional colleagues and limited access to medical supplies and specialized equipment. The military applications of plague doctor expertise made these practitioners valuable consultants. During wartime, when armies faced epidemic diseases that could destroy fighting forces more effectively than enemy weapons, military plague doctors developed specialized knowledge about treating epidemic diseases under field conditions and managing disease outbreaks in crowded military camps. Their expertise in rapid treatment and disease prevention made them essential military medical specialists. The end of a plague doctor's career often came suddenly through death from the diseases they treated, making retirement planning and career transition unusually difficult. Those who survived epidemic periods often found their skills less relevant during normal times, when traditional medical practice resumed. Some transitioned to other medical specialties, while others continued working as general practitioners in communities that had been devastated by epidemic disease. The psychological aftermath of plague doctor practice created long-term mental health challenges for practitioners who survived epidemic periods. Many suffered from what we would now recognize as post-traumatic stress disorder, experiencing nightmares, anxiety, and depression related to their experiences during epidemic crises. Some developed alcohol dependencies or other coping mechanisms that helped them manage memories of the mass death they had witnessed. Medieval plague doctor practice established precedents for modern epidemic medicine and public health emergency response that continue to influence contemporary medical practice. Their development of protective equipment, quarantine procedures, and emergency treatment protocols created templates for modern infectious disease management. Their recognition that epidemic diseases required specialized medical approaches and emergency response systems anticipated modern epidemiology and public health practice. The professional dedication demonstrated by plague doctors who remained at their posts during epidemic emergencies established ethical standards for medical practice during crisis periods that continue to guide contemporary healthcare professional behavior. Their willingness to risk personal safety to provide care during dangerous conditions created models of professional courage and commitment that inspire modern healthcare workers facing epidemic diseases and emergency situations. Most importantly, plague doctors preserved medical knowledge and treatment approaches during periods when normal medical education and practice were disrupted by epidemic disease. They documented their observations and experiences in ways that contributed to medical understanding and provided information that helped future generations better understand and treat epidemic diseases. So what did a medieval plague doctor's daily routine look like? It was a carefully orchestrated dance with death that combined primitive medical practice with sophisticated protective procedures, desperate innovation with professional dedication, and personal terror, with unwavering commitment to providing care during humanity's darkest hours. They developed daily routines that helped them function professionally, while surrounded by mass death, creating structure and purpose in situations where normal social systems had completely collapsed. They proved that medical professionals can maintain their dedication to patient care even when success rates approach zero and personal risk reaches maximum levels. They demonstrated that human compassion and professional duty can persist through the most extreme circumstances, providing comfort and hope even when cure was impossible and death was nearly certain. The next time you appreciate modern medical care or wonder about professional courage in the face of dangerous diseases, remember the medieval plague doctor who put on his beak mask each morning, walked deliberately into communities devastated by epidemic disease, and spent his days treating patients he knew he probably couldn't save, risking his own life to provide whatever comfort and care was possible during humanity's greatest medical emergency. If you enjoy the hidden sides of medieval life, hit subscribe and give this video a like.